Today's HealthLine webinar from the American Association of Kidney Patients titled The Kidney-Gout Connection, Understanding the Link Between Uric Acid and Renal Health. Thank you for joining us today. My name is Jerome Bailey, and I am AAKP's Director of Patient Engagement and Advocacy. Today's HealthLine webinar event is a special collaboration with our longtime allied partners at the Alliance for Gout Awareness, as we recognize National Gout Awareness Day held annually on May 22nd. AAKP serves kidney patients across the disease spectrum and with various causes of kidney disease. But in partnership with the Alliance for Gout Awareness, AAKP aims to increase awareness of the gout and kidney connection, debunk myths about gout, and ensure individuals impacted by this condition know their treatment options. As the oldest and largest fully independent patient-led kidney patient organization in the U.S., AAKP is proud to host our webinar series as a service to our fellow kidney patients, family members, and care partners, healthcare professionals, researchers, and policymakers. AAKP's HealthLine and HealthLine Innovative webinars fall under our Center for Patient Research and Education. We believe patient and care partner education is an integral part of an individual's treatment, and to that end, AAKP is a champion for research and innovation, the protection of the patient-doctor relationship, and the elimination of artificial barriers and government determinants of health that impede patient care choice and access to all available treatment options. At AAKP, we work to ensure that patients have a central role in the research and innovation process so that unmet needs are identified and unique patient insights and lived experiences fully inform the research and product development lifecycle. This includes clinical trials to regulatory action and payment decisions. We are proud to bring you this educational webinar on gout. It is a painful condition that affects more than 9 million Americans. It is important to note that gout can lead to kidney disease, and having kidney disease can increase the risk of developing gout. During today's presentation, featuring our allies at the Alliance for Gout Awareness, we'll be exploring the causes and symptoms of gout, strategies for managing the condition, and the important work we're doing together to reduce the stigma that surrounds it. But before we hear from our speakers, we want to share some compelling insights gathered in the lead up to today's event. Through AAKP's Center for Patient Research and Education, we conducted an independent flash survey to better understand the real-life experiences of individuals living with gout and how it intersects with kidney health. Let's take a look at some of the results. As you can see, we reach a wide and diverse group of respondents across our networks, offering us a strong snapshot of patient perspectives. Here, we see that most participants reported having at least a basic understanding of gout, so awareness is there, but there's definitely room to grow. More than half, 56% of those surveyed said a healthcare professional has talked to them about gout, which is promising. However, it also means nearly half may not be getting that important dialogue from their care team. Over 60% of respondents indicated that they have personally experienced gout. Couple that with those who responded with unsure, we could potentially have more than 70% of respondents having experience with gout. And 80% told us that when a gout flare occurs, it has a negative impact on their daily lives, underscoring just how disruptive and painful this condition can be. When we asked which parts of daily life are most affected during a gout flare, the top three responses were foot pain, difficulty walking, and swelling, clear reminders of how gout affects mobility and quality of life. In terms of management, most respondents indicated that they are treating their gout with prescribed medications, followed closely by dietary and food medications. Finally, And perhaps most significant, nearly 60% said they are aware of the link between gout and kidney disease, that gout can contribute to kidney problems, and kidney disease can worsen gout. However, nearly half of respondents were unaware of that, reinforcing the continued need for education and awareness. These findings give us a clearer picture of where people stand and the challenges they face. They also emphasize why conversations like today's are so critical. By deepening our understanding and raising awareness of connections like the one between gout and kidney health, we can empower patients and caregivers to take informed action. Now let's turn it over to our speakers for today's presentation. It's my pleasure to introduce our first speaker, Olivia Perry. Olivia serves as the Coalition Director for the Alliance for Gout Awareness, where she brings together key stakeholders to address priority issues in gout care. She leads national education and advocacy campaigns and directs outreach efforts to federal agencies and lawmakers to improve awareness and policy around this often overlooked condition. A native of San Diego, California, Olivia holds a Bachelor's of Art in Global Interdisciplinary Studies and Spanish, with a specialization in political science from Villanova University. She also earned a Master's of Science in Public Health from Johns Hopkins Bloomberg School of Public Health. Please join me in welcoming Olivia.
Jerome, thank you so much for having me and for having the Alliance for Gout Awareness on today. We greatly appreciate, the opportunity to join you all to talk about gout and for your continued partnership as an organization. So today I'm going to talk a little bit about the Alliance for Gout Awareness and some of the work we do as we approach Gout Awareness Day, which is coming up on May 22nd. So, starting off with the mission of the Alliance for Gout Awareness. So, what we really work to do is reducing stigma and empowering patients, and that's through improving kind of the public understanding of gout. We really work hard to address a lot of the common misconceptions, heighten public awareness, and we do that through developing educational materials, support resources, and working together with our wonderful members to kind of achieve this work as well. So here you will see some of our incredible members. We have about 16 different members that are a part of the Alliance for Gout Awareness. And one of the, I think, the most important things about our membership is just kind of the cross collaboration in a lot of the different disease areas that you'll see represented here on the screen. Gout is a whole body disease, and so we really want to make sure that we are including kidney, that we are including podiatry, cardiology, rheumatology, all of these different areas that really are impacted by gout and can impact gout. So as you'll see there, AAKP, which is a fantastic member of ours, and some of our other members there on the screen as well. So just to touch on a few areas that we focus on. And so as I mentioned, I think, the core of AGA's work is really focused on raising awareness around gout and really working to address that stigma through education. There continues to be a pretty high stigma around gout. It can significantly impact patients' willingness and ability to seek treatment, to seek care, and to kind of find the resources that they need. And so that's something that we work hard to do, not only with patients, but with providers, and with just people amongst the community in general. As I mentioned, we also work a lot on patient education. AGA hosts virtual as well as in-person events for gout patients, as well as our care partners, which is also a very important part of the treatment process. And we also will often partner with local chapters or organizations really to ensure that we're expanding the patient reach. We really work to, develop a variety of educational resources. We create videos, infographics, papers, really making sure we can have the best resource possible for each individual patient, and we can meet the patients where they are and fill the needs that they have. AGA also works to address policy issues. So there are a lot of common access barriers that could impact a patient's ability to access treatment. These are often referred to as utilization management policies. So these are things like step therapy, prior authorization, copay accumulator programs, all issues that can often negatively impact patient access, can really get in the way of a patient and provider making the best treatment decision possible. And so AGA, along with its members, works to engage at the state and federal policy levels, as well as often at the plan level, really to make sure that policies are in place that can ensure timely patient access. Because as we know, not only in gout, but in many conditions, any sort of delay in treatment and in access to treatment is often a significant negative impact to the patient and can really delay the successful outcome that we hope to have with, achieving that treatment. And then, as I mentioned before, I think a really important area of our work is the cross collaboration. Gout really is a whole body disease. We like to, it's when left unmanaged, it can increase the risk of heart attack, of stroke. It is also related to kidney disease, as you'll hear later on as well during this webinar. And so it's really important to AGA as an organization that we are working across these disease areas, really making sure that we are bringing all of these different voices together when we have the gout discussion to ensure that people kind of have that understanding about the role that gout can play, not only in kind of the rheumatic side, but across the body as well, and making sure that we are kind of bringing all of those different pieces together. And then finally here, you'll see a few examples of some of the educational resources that the Alliance for Gout Awareness produces. You'll also see our website there in the middle where you can find quite a few more resources as well, not just those included here, but as I mentioned, we do produce videos, we have infographics, graphics for social media, one-pagers, papers, really trying to kind of share a variety of resources when we're talking about a lot of these issues, ensuring that patients have the resource that is most comfortable for them, that they can kind of digest the best. You'll see a few examples here of some of our resources around management, reducing stigma, the utilization management policies that I mentioned before, navigating physical and mental health around gout, as well as a resource around a roadmap to better care for gout. So these are just a few of our resources here. And as I mentioned before, you can find all of our resources on our website there. So thank you so much again, Jerome, for having me on today and for the opportunity to talk a little bit about the Alliance for Gout Awareness and gout, and really, really appreciate our partnership with AAKP. It's always a wonderful opportunity to continue working with you guys.
Thank you for that great overview of the Alliance for Gout Awareness and the important work being done to raise awareness and drive change. And we are too grateful for the continued partnership between AAKP and the Alliance. Now, I'm pleased to introduce our next speaker, Dr. David Mandel. Dr. Mandel has been a leading voice in the care of patients for rheumatic diseases in Northeast Ohio for over 4 decades. Although he recently retired from clinical practice, his impact on the field continues through his leadership, research, and advocacy. Throughout his distinguished career, Dr. Mando practiced at University, Lake, and Hillcrest hospitals and participated in more than 150 research trials. Many focused on biologic therapies for arthritis and innovative treatments for osteoporosis. He has authored numerous articles and remains a trusted source of expertise in the field. A passionate advocate for patients, Dr. Mandel is the founder and past president of the Ohio Association of Rheumatology, an organization dedicated to educating policymakers and insurers on the unique needs of those living with arthritis. He also played an important role in training future healthcare professionals by teaching rheumatology at several academic institutions. Please join me in welcome Dr. David Mandel.
Well, good morning, everyone. I hope people are enjoying these lovely times of spring with all the beautiful tulips, daffodils that are sprouting. And I appreciate the invitation this morning to talk a bit further about an important disease, and that is gout arthritis. Many people don't always recognize that gout is a very serious inflammatory form of arthritis. In fact, from a numbers point of view, most of us think about rheumatoid arthritis or psoriatic arthritis or a back condition called ankylosing spondylitis, and those compose about 6.5, maybe 7 million people in this country. Right now, we're living with an epidemic of gout with more than 12 million people suffering some of the ravages of gout. My focus today will first start with what is the basic premise behind gout. And gout is related to an abundance of too much uric acid in our body. Well, where does this uric acid come from? It comes primarily from purines, which are protein building blocks that make up our normal healthy skin, our joints, as well as they compose the structure of our organs, such as the heart and the kidneys. Well, some people are predisposed genetically not to excrete uric acid from the body. And when we have too many purines in our system, we overload our body, whether it's in our joints or in our kidneys, with too much of this toxic product called uric acid. Some of you may be familiar with having a family member or yourself who's had painful attacks of gout arthritis. And many people have this, as Olivia mentioned, this stigma that, well, gout is just due to people drinking too much wine or beer or whiskey. And often healthcare providers have that same stigma, which we'll address a little later when we talk about effective treatment. It's important for all of us to know that, yes, there are certain foods that lead to excessive uric acid. Sardines as a fish, liver. We mentioned drinking excessive amounts of alcoholic beverages. Too much of high fructose sugary drinks lead to uric acid overload. So there are things that we can do in our own lifestyle to modulate these. One important issue is we all need to know what's a normal uric acid. 6 milligrams percent in the blood is normal. And that's something we can all have a conversation with our doctors about. Just like when we see our healthcare provider, we talk to them about, well, what's my blood pressure? Or they'll address, well, your cholesterol is normal. It's under 200. It's 160. So we mentioned that there is this critical link between uric acid and other parts of the body. For example, when people have frequent attacks of gout or their uric acid remains higher than 6, they're more likely to have uric acid kidney stones. We know that when people have had acute attacks of gout, they are more likely in the following months to have a heart attack. Uric acid, think of it as a conductor of many body systems. For instance, insulin doesn't work as well when we have a high uric acid. When we also run a high uric acid over 6 milligrams, our kidneys don't work as well. They don't filter the materials as properly as they should. So this understanding of gout as, well, it's just a painful, swollen joint, dismiss that, put that aside. That's just the tip of the iceberg. Gout, as Olivia mentioned, affects many, many body systems. And when we can't filter uric acid because of high uric acid, the kidneys don't work as well. So there's this symbiotic role play between high uric acid and kidney function. We also know that certain illnesses like having high blood pressure, having diabetes, having high cholesterol, these coexist more often in people who have gout arthritis. So on this first slide, we all could look at it and say, oh, okay, this is what often happens to people with gout. They get a red hot, swollen joint. And what many people who have suffered the pain of gout will say, I thought this was the worst pain I ever had. I broke my wrist falling, but this pain of gout was much worse. In fact, many women who've given birth to 2 or 3 children will say, you know, I'd rather give birth to another child than have the pain that I had with my attack of gout. That's how anguishing and ravaging the pain of gout can be. So in this slide, what you're looking at is the white uric acid deposition that has filtered through the body and now is deposited within joints, or as we mentioned in the kidney stones, or again, uric acid can deposit in the heart. It can deposit in the eyes. So uric acid, when it remains persistently high, over 6 milligrams, it can deposit anywhere. And it's important that we normalize uric acid, and we'll talk about this with treatment a little later. Here's what happens to many people who do not treat gout seriously. And you can see the lumps and bumps over the knuckles of this individual who had 25 years of gout. And again, he had very commonly seen hypertension and diabetes with his gout arthritis. I want to just step back a minute, look at these hands. How could a mechanic work with his tools with these hands? Or think about it, if you're a quilter or you enjoy golf or tennis, how could you comfortably squeeze simple objects with these hands? So it's not just the pain, but it's the disability and impairment that so many people suffer needlessly with gout arthritis. So this is a picture of a uric acid kidney stone. And you can see with the ruler here in diameter, it's almost 2 inches. Now let's again think about, where did this uric acid kidney stone come from? It came from the kidneys. Now, we have these wonderful tubules that form in the kidneys and go down to the bladder. We call these tubes the ureters. This kidney stone is 30 times the diameter of a 1.5 millimeter ureter. Ouch, for that kidney stone to try to pass through the ureter. The treatment of this today would either be surgery to excise that kidney stone, or sometimes they use a blaster, if you will, to pulverize and reduce and eliminate the stone so it can eventually decompose and pass. The most severe complications, though, that happen to the kidneys when people have persistent gout and other medical illnesses is that they end up on dialysis, as this gentleman is, as you can see, sitting with a dialysis machine where he goes 3 times a week, as more than 500,000 people in our country go to different dialysis centers. So the complications of having gout, having high uric acid, are more than just that painful red toe. So the good news is, and there is good news, and I think it's important for all of us to realize gout is a manageable and controllable condition. We have certainly the basics of lifestyle changes, reducing some of the excess purine foods that we talked about, the high amounts of alcoholic beverages, or I can think of a patient who we were in some ways joking about and talking, and she said, Dr. Mandel, I have to have 6 diet colas a day. And I said to her, Ruth, isn't it possible for you to just cut it back to 1 or maybe 2? And we sometimes get into a rut where we just keep doing things the same old way and expect a different outcome. And it's just not going to happen here. So the starting point always reflects on the patient and to make some healthier choices during the day. There are some very effective oral medicines that have been available to lower uric acid and prevent attacks of gout. And these include allopurinol, fibutazat. These are generic medicines, not that costly, and they are effective. But what about those patients who end up having refractory gout? They do their best to make lifestyle changes. They are compliant with their oral medicines, and there are groups of people like this. There are newer intravenous medicines. Cristex is one that can be administered as an outpatient. It's been around close to 15 years, and it's very effective. And it can eliminate those lumps and bumps of uric acid that we saw on those gentlemen's hands in a matter of weeks. So he and other people can get their life back so they can enjoy holding a golf club or holding their grandchild in a very comfortable way. And there are some new medicines. In fact, some of you, if you watch TV, you see some of these new medicines that slow down the kidney damage and are used for diabetes as well. Some of those have actually gone into trials now to see that they can lower uric acid. And so we may be using these medicines as an adjunct treatment to lower uric acid. There are also some new intravenous treatments that are really becoming almost revolutionary in their impact on treating patients with the more severe forms of gout. I'd wrap up and say, though, the challenge for many people with gout is to realize, one, this is a very manageable and treatable illness, and that when you see your healthcare provider, it's really important and incumbent on you to talk with him or her about your desire to want to treat gout differently. Because too often the patient and the doctor, they do this dance with each other that, oh yeah, I had an attack of gout in February this year. Yeah, I was in the ER in December with gout. But doctor, I have all these medicines. It costs me a lot. I'm not having any pain now. Maybe I'll just try to cut back a little bit on my beer. And then what happens? They find themselves in July of this year back in the ER again. Attacks of gout don't have to control you. You can do the right thing and step up and manage gout in a very healthy way. So I'm very encouraged by what we can offer patients and what patients can do to change and provide a really manageable and happier life when it centers around gout. Thank you.
Thank you, Dr. Mando, for that wonderful presentation. We appreciate you being here. We do have a few questions for you and Olivia that people who registered for today's event submitted that I'd now like to ask you both. The first question is actually for Dr. Mando, and it is, how can someone tell the difference between gout pain and other types of joint pain, especially if they already have other health conditions?
Yeah, I think that's an excellent question because sometimes it is hard to differentiate the painful swelling of gout from, for instance, other types of arthritis. People might have underlying rheumatoid or psoriatic arthritis, and sometimes what we'll do is we'll actually, from a painful swollen joint, we will aspirate, will anesthetize around the joint and remove fluid from the joint, which may provide that kind of information because we'll see uric acid crystals in the joint fluid. And these uric acid crystals are what are leading to the painful attack of gout. Now, there may be some other blood tests that can be done as well to determine is this indeed an attack of gout, or as I mentioned, it may be another condition. Lastly, Olivia mentioned about the role that podiatry has, which is very important today because they are often the first eyes on an attack of gout. And getting an x ray sometimes can be helpful because people might have a stress fracture that was undetected.
Okay, our next question is for Olivia, actually, and you kind of hit on this earlier, Olivia, in your presentation, but can you talk a little bit more about the resources and tools your organization offers to patients living with gout or concerned about their uric acid levels?
Absolutely. Thank you so much, Jerome. As I mentioned before, the Alliance for Gout Awareness develops quite a variety of educational resources for patients, as well as for providers, and also for care partners and family, for people, who may know someone who's going through gout. And so we really try and have quite a wide variety of resources. We have videos, one-pagers, infographics, on quite a variety of topics as well. So something as basic as what is gout, like a frequently asked question document, and something more, a little bit more detailed. So, as we're talking about today, kind of the connection between gout and kidney disease, the connection between gout and cardio, as well as, some of those common access barriers, what those might look like when you are kind of developing your health plan and looking at that, what are some things to be aware of, all sorts of things like that. And so we really try and have a good wide variety of these resources. We do also have resources available in Spanish as well as some other languages. So really trying to expand as much as possible these resources. They're all online, easily accessible as well. And so really just making sure that we have the resources that patients need and they can be in different formats. I know, some people prefer video, some people prefer a one pager. And so having different options for patients as well to make sure they have what they need.
Great, thank you. This next question is also for you, Olivia. How can patients become stronger advocates for themselves, especially when talking to doctors who may downplay gout symptoms?
Absolutely. I mean, this is something that we talk about with patients quite a lot in the work that we do. And, something that I really like to remind patients of when we have these conversations is that they are an expert in their lived experience, right? They are the ones who know what they're feeling, who know what they've been experiencing. The clinician will often, you see them a few times a year potentially or less. And so they hear, from you what you're telling them, but you have to remind yourself that you are the one who's coming in with a certain expertise, and so really being able to kind of hold that power a little bit and being able to share what your experience is, not letting them kind of downplay any potential symptoms, things like that, and just really trying to come in with as much detail as possible as well. I think being able to kind of take note as things are happening and being able to share that with a doctor. Sometimes it's easier to have it in writing. It helps you remember, and so you don't get nervous, or I often even get nervous when I go into a doctor's office, and so helping to remember all the things you need, having those things written down. But I think really just holding your personal expertise and your experience when you go in and talk to those clinicians.
Great, thank you. This next question is for Dr. Mandel. What lifestyle changes have you seen make the biggest difference for your patients managing both gout and kidney problems?
Yeah, I think getting always back to the basics, Jerome, of changing one's lifestyle with nutrition can make an impact, as we mentioned, cutting back on. If, one likes to drink too much, whether it's colas or beer, that has some impact. But the misperception is that lifestyle alone will cure and control gout, and it just rarely does, if at all. And I think what Olivia was just saying about when one works with his or her healthcare provider, sometimes bringing in a spouse, a significant other, a second voice can be really helpful to embellish on just how impactful gout has been, because there is this stigma of gout. And as much as lifestyle changes help, one of the most critical things one can do to manage attacks of gout is to get on medicine. And as I said, not all medicine is perfect. Some have side effects, but most people can tolerate usually these medicines. And when the orals don't work, we've got this wonderful backup with intravenous treatment.
Another question for Dr. Mandel. Is gout just a joint condition, or are there long term health risks um, patients should be aware of?
Yeah, I'm glad you asked that because, again, one of the slides I have on another talk is I show this little emerging tip of the iceberg where people understandably think of gout as just it's my big toe, but gout can affect the uric acid, can deposit, first of all, in any joint, the knee, the hip, and many people go in to their doctor thinking, gee, I've got some hip bursitis, and what it is it's an attack of gout. Olivia mentioned the cardiac issues. What is very important is that when one has an attack of gout, they raise their risk of having a heart attack twofold. Now, think about this. If you've already got risk factors, as you're a smoker or you have high blood pressure, you've raised your risk of having a serious heart attack four or fivefold. And we also talked about other systemic effects, such as the kidneys. When one has persistent uric acid levels over 6, blood flow to the kidneys is significantly squelched and diminished. And that can lead again to what you now see as under the acronym CKD, chronic kidney disease. Normal kidney function is staged at level 1. But as you go to higher levels of chronic kidney disease 3 and 4, you run the risk of having more attacks of gout because the kidneys can't filter that uric acid out of the system.
And my final question is for Olivia. Are there any current advocacy efforts that people living with gout or kidney disease can get involved in to improve care and access to treatment?
Absolutely. As I mentioned before, one of the things that we work on is a lot of these common access barriers. So things like step therapy, prior authorization, copay accumulator programs, these policies that can often get in the way of, patient and provider making treatment decisions that can really get in the way of patient access. And so there are state policies that control that. There are federal policies. And so, we really try and encourage that, legislators need to hear from patients. They are the ones, as I mentioned, they are the expert in their experience. And so making sure that, patients contact their legislators on around these issues, on these laws. I know AAKP has an action center. The Alliance for Patient Access also has a letter desk as well on a lot of these issues. We have recently seen the Help Copays Act, and that's federal legislation around copay accumulator programs reintroduced. And so there are opportunities to submit comment there and to write to legislators. We hope to see other legislation as well, but keeping an eye on the state level. But I think, really making sure that patients, provide information to their legislators, that they're communicating with their legislators, that these are policies that are important, that they have significant impacts on patients, on care, on treatment. And so, having those opportunities to kind of submit letters and comments are constantly available for patients.
Dr. David Mandel and Olivia Perry, thank you both for joining us and providing the latest information about gout and its treatment. Your presentations were highly informative and greatly appreciated as always. And now it's my pleasure to introduce our final speaker, Richard Knight. Richard is a transplant recipient, healthcare advocate, and former president of AAKP. As a former hemodialysis patient, he brings vital firsthand experience to his advocacy for patient centered care. His background spans finance, business development, healthcare, and public policy. Richard also served as a Capitol Hill staffer and legislative director, having worked with the Congressional Black Caucus and the House Energy and Commerce and Small Business Committees. Today, he is a business strategist and adjunct professor at Bowie State University, where he serves on the College of Business Advisory Council. He is deeply committed to promoting diversity in clinical trials and advancing innovation in kidney care. Please join me in welcoming Richard Knight. Hey, Richard.
Thanks, Jerome. Thanks,
No
Jerome, for that very generous introduction.
No problem. No problem. So, Richard, can you share a bit about your kidney journey with gout and when it first appeared in relationship to your kidney disease and transplant?
Certainly. And let me tell you, this is something that anyone who has chronic kidney disease needs to be aware of. I was unaware of it. Back in 2015, I had my transplant in 2006. So for 9 or 10 years, I never suffered from gout. So I thought I was okay. Back in 2015, I woke up one day and I simply couldn't walk. I was working with a colleague. We were doing some business development, going after contracts, things of that nature. So I went over to his house and he said, "Hey man, what the heck happened to you?" I said, "I don't know, man. My foot hurts and I can barely walk." Had no idea. And I actually suffered through it for almost a week and it went away. A couple of months later, it occurred again, and I said something's not okay. So I did what I should have done the first time. I went to the doctor. The interesting thing is, she asked me. She said, "Are you familiar with gout?" I said, "Oh no, I don't have that." And when she left the room, I went to Google, looked it up, and I said, "Oh my goodness, I do have that." And she was kind enough to give me some medication. And Jerome, I'll tell you, the medication helped, but it wasn't a cure all. So the medication cleared things up. And for the longest time, I simply watched my diet. No red meats, a number of other things. I don't drink, but no alcohol, no beer, no red wines. Minimize, again, I don't drink sodas. The fructose in sodas is very harmful. So I began to study it and become a student so I would know what might cause me harm. No, no meats except for chicken. And it was an interesting situation. And I evolved because I learned that it can be managed through diet and exercise, but there were some medications that would also be very, very helpful to one. The initial medication I was given, colchicine, cleared it up. But in a few years beyond the diet, I discovered um, another medication, which is called allopurinol. So I'll pass it back to you, Drone, for some more questions.
Yeah, can you talk a little bit more about what a typical gout flare-up feels like for
No.
you? And I know you described the meeting with your business partner. How does it also impact your daily life?
Pain, extreme pain, unable to walk. When I was lying in bed, my bathroom was a couple of feet away. I simply held things as long as I could. The flare up happens, if I can explain this, I'll be brief, but it's important to understand. Think of a bathtub full of water. Your body is full of uric acids. And when you have a flare up, you've had something that caused you to go over the bathtub, the overflow, if you will, as an analogy. And that's what causes the extreme pain when you have a flare up. Ultimately, when you learn how to treat it, like through the allopurinol, for example, it actually drains the bathtub so that you can eat the foods. But during the flare up, which is caused by, how can I say it, little salt crystals nestling in your joints. For guys, I think for guys and women it may present a little bit differently, but for me, it nestled in the joint where your big toe is, and they would get real sharp and jagged. Of course, they're very small, microscopic, but your nerves would flare up, and the pain would simply be excruciating to the point where you literally couldn't walk. Fortunately for me, I only had it in one foot. Some people get it in both feet, hands, arms, elbows, different joints. So again, the pain is simply excruciating, and it's something that you simply have to have release from.
So it sounds like you really didn't have any challenges finding treatments. Is that true? Did you have trouble finding treatments that are safe, for your kidney health and your gout?
In a word, yes, because I didn't know. I simply thought that by restricting my diet to meat such as chicken and not eating, of course, I don't drink, no soft drinks, and a lot of other things such as red meat, shellfish, oily fish, um, just having barbecue sauce that had fructose in it and sucrose. That was problematic. So that was treatment by avoidance. When I really learned what was causing it, and this happened over a period of a couple of years, Jerome. So that's why I'm saying not so much that I had difficulty finding treatment. I had difficulty fully understanding what it was and how to best handle it. So then I became familiar with allopurinol, which helped my body. Your kidneys drain the uric acid, and a transplant is great, just like dialysis is great. It doesn't replace a kidney, and a transplanted kidney is great, but it doesn't have the full functionality of your 100% of your original kidney. And so it had difficulty draining that uric acid. So once I understood that, I was okay, and I haven't had a flare up since 2017.
Wow. Do you have you found that any particular lifestyle changes? I know you mentioned diet, but what about hydration, exercise that help prevent the flare-ups?
Absolutely, absolutely. The number one, and this are I'm not separating the two because the transplant and the gout, what I need to feel the best that I can is the same treatment. So exercise, and I'm not a gym person, but I do walk a lot. I do stretching exercises and I walk a lot. Um, drink drink plenty of water. Always have something to drink with me before we start the session. You saw me drinking water, and I just do that throughout the day. And to be honest with you, because the other thing that comes into play is being a diabetic, which did not happen until recently. So when you put it all together, you got to be pretty careful with your diet. For example, I can eat red meat now. That's not something that I have every day. I can have scallops, crabs, shellfish. But again, I limit it. As I explained to my son, I can do these things in moderation with the combination of the medication I take, the allopurinol, some exercise, and certainly having a diet. And I just think anyone should have, a reasonably balanced diet. But there are even some vegetables that may give you problems, certain types of green vegetables. But like I said, fortunately, with balance, you can really manage this. But you just have to be intentional. I've had plenty of friends that describe something to me, and I said, first of all, I'm not a doctor, so I'm not going to diagnose you. But you might ask your doctor if you have gout, and the blood work will be able to let them know, and they can prescribe you something that can help you out. Because many people like me just didn't know, Jerome, and they're
Yeah.
steadily grilling steaks, barbecue, and can't walk for days.
Hmm. So, Richard, what's one thing you wish more healthcare providers understood about living with both gout and kidney disease?
I think being proactive and explaining certain things to you. And we know sometimes healthcare providers are limited in time, and they may be reactionary as opposed to proactive. If someone said, these are things that can happen to you, and here's a guide that can give you some indication as to if you have these symptoms, this is what you should do. Of course, you're going to go back to the healthcare provider for that direction, but at least being aware that if you have some type of sharp pain, that it could be caused in the joints, of one of the joints of your body, it could be caused by gout. And just living well with kidney disease, particularly whether it be a transplant or on dialysis, it's important to have that communication with your healthcare provider. I'm getting ready to call my nephrologist now because I would check with him before I take any medication that is prescribed to me by someone else, because I want to make certain that it's not going to interfere with the medication I'm taking for the kidney. So we need to be aware of those types of things and just be cautious as we approach. But I'm going to be the one to tell you that despite those challenges, I live a very good quality of life. Very good.
Yeah. Richard, last question. What advice would you give to someone newly diagnosed with gout who also has kidney disease?
Okay, a couple of things. Number one, I'm big on education. So the first thing I'm going to do is direct you to go to AAKP's website and look up some of the information that we have about gout. The second thing is, if you've been diagnosed by your doctor, then ask them certainly for their advice. And they're probably going to give you a list of foods that you need to avoid. And they're also going to give you some medication that will help your body get rid of the uric acid that develops that will cause you to have that gout. And I think with those two pieces of advice, you'll be in pretty good shape because I have to say, as I mentioned earlier, I have not had an attack or flare up since 2017, and it's allowed me to live a very good lifestyle, quality of life.
Richard, thank you for sharing your kidney journey and your experience managing gout. Your openness and willingness to share your story with us is truly appreciated. If anyone watching has additional questions for our speakers or about today's webinar that we were unable to get to, please email us at info@aakp.org, noting the webinar title in the email subject line. In closing, if you are not already a member of AAKP, we encourage you to join. AAKP offers free membership to patients and their family members, as well as living kidney donors. To become a free member, join online at aakp.org/join or by phone at 1-800-749-2257. To receive all the benefits of membership, please be sure to include your email address when signing up. As an AAKP member, you will be notified about all of AAKP's upcoming events, the latest in our educational program series, and when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. We encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the independent patient voice and change status quo kidney care. You will also receive a digital subscription to our bi-monthly magazine, AAKP Renal Life, and can select to receive any of our 5 different electronic newsletters, all for just signing up. We also invite you to check out our blog to read some great articles and patient profile stories, and follow us on social media for all the latest news and to keep up on what's trending. AAKP is dedicated to helping kidney patients across the disease spectrum understand their condition and take control of their health care. We are proud to offer a variety of resources for both patients and care partners. By visiting our website at aakp.org and clicking on the AAKP Store button at the top of the homepage, you can find a variety of educational brochures and online tools to order or download free of charge, including titles such as AAKP Understanding Gout and Your Kidneys brochure, or the AAKP Nutrition Counter, a reference for the kidney patients. You can also order materials by phone. Looking ahead, we're excited to announce the dates of our 2025 AAKP signature events. The 7th Annual Global Summit on Kidney Disease Innovation is taking place over the next 2 days, virtually May 22nd and May 23rd. The event is hosted by AAKP in partnership with the George Washington University School of Medicine and Health Sciences. Registration is free and is now open. The 8th Annual AAKP Public Policy Summit is taking place June 27th at the National Press Club in Washington, D.C. There is both an in-person and virtual option available. Registration is free and is open now. And the 50th Annual AAKP National Patient Meeting is taking place October 3rd through the 5th in Fort Worth, Texas. This year's event will be a hybrid with in-person and virtual options for attendees. Join us as we celebrate this year's golden anniversary. Registration and housing will be open soon. Additionally, don't forget to visit our AAKP On Demand webpage at bit.ly/AAKP On Demand to watch inspiring presentations from 2024 and upcoming 2025 events and explore even more great educational content on our AAKP YouTube channel at bit.ly AAKP YouTube. We would like to extend a heartfelt thank you to our webinar speakers, Olivia Perry, Dr. David Mandel, and Richard Knight, for graciously participating in today's HealthLine event. Their expertise and insights greatly enriched the discussion and provided valuable information. We also want to express our gratitude to all who joined us. Please share what you learned with others. Thank you again for joining us. Please help us spread the word about National Gout Awareness Day. Thank you, and we look forward to you joining us for another great Healthline event.